Hi, everybody. I'm here with Dr. Villodas, who is a professor and assistant professor at George Mason University in the social work department. You've been here since 2022, right?
Yeah.
Um, Dr. Villodas has been interested in researching the impact of mental health outcomes and connectedness and placement in society and issues like that. And so recently, you and colleagues published a paper research indicating that Black youth who have been interacted with the juvenile justice system exhibit worsened mental health systems during their transition into adulthood. And so this is kind of groundbreaking research. How did you come to be interested in studying the relationship between interconnectedness and mental health and the particular study that you pursued?
Yeah. Well, the short answer is my clinical work brought me to studying this, but I'll offer a little bit more context than that. Let me start by saying that my research predominantly focuses on Black youth's mental health. So when I say Black youth, I tend to mean those across the African diaspora. So meaning first and foremost, due to our context here in the United States, African American youth, but also Caribbean youth, Afro-Latino youth who are Latinos who racially identify as Black, and youth who are or come from parents who are African immigrants. So that being said, these populations of Black youth are people who I found myself working with as a social worker in New York City, where I'm from, and where I also practiced social work as a mental health clinician among youth who encountered systems of care, primarily foster care. So where does juvenile justice fit in there? Well, there's something called crossover youth. And these are youth who are involved in both the child welfare system as well as the criminal justice system or juvenile justice system. And this is very common among foster care youth. So I became interested in justice involvement, first and foremost, because of how the systems of foster care and juvenile justice systems overlapped with my clinical work with foster youth. But as part of my research training, I'd begun to learn more about the disproportionate contact that Black youth make with the juvenile justice system, which is very similar to the disproportionate contact that Black adults experience in the adult criminal legal system due to systemic racism. And I'd also begun to learn about their disproportionate access to mental health care after entering the system, which for many youth, entering the system of juvenile justice is their very first time accessing mental health services. So as you can imagine, issues around over-policing Black youth abound, as well as poor access to mental health services abound for this population as well. And this is unacceptable. But thinking from a strengths-based perspective, which these populations don't really get that strengths-based lens portrayed for them, in research, there's a lot to learn about the connections that are working for Black youth to help mitigate mental health problems. So I like to think that Black communities have invaluable community networks that have been protective for so many Black youth in our communities. And so that's how I became especially interested in honing in on connectedness as a buffer against mental health challenges. Black youth don't always access the mental health services that they need, for a variety of reasons. So how do we facilitate communities of care with trusting individuals to offer healing? And what ways do communities already do that? Through connectedness. So that's sort of the long-winded answer.
Perfect. So as you pursued this research, what supports did you find along the way and what obstacles did you have to overcome to get the research through?
Yeah, well, I'll start with supports because they may be a little bit shorter. Supports definitely come from, this work comes from my dissertation research. So in pursuing this topic, I had a lot of great support from my committee members, Dr. Emmy Blank Wilson, who was my chair, Dr. David Ansong, and Dr. Trinette Clark Goings. They're all at the University of North Carolina at Chapel Hill, my alma mater. And my other committee members, Dr. Michelle Munson at NYU and Dr. Von Nebbit, who's now at University of Nebraska, Omaha, have all been very supportive, as well as my co-author, Dr. Daniel Gibbs, who just recently graduated. And so they've been champions of my work. The faculty here at George Mason University have been champions of my work. And so my support has really come from a network of people who believe in the work that I'm doing. And so the obstacles come from systems, right? In terms of obstacles, I would say that the biggest was that there isn't a robust body of literature or data, for that matter, focusing on the mental health of Black youth in juvenile justice systems. I mean, we know quite a bit about the likelihood of having mental health problems among those generally involved in the juvenile justice system. Thanks to research, we know that 80% or upward of 80% of youth in the juvenile justice system with one mental disorder also meet the criteria for a second. So there's a lot of mental health challenges that are compounded on top of each other. And we know that Black youth in particularly are less likely to receive contact with mental health professionals upon intake and discharge. So all that to say, there are obstacles related to existing research. There isn't enough research, in particular around this population. But this did create an opportunity for me to carve out some space for me to explore how mental health challenges persist over time among justice-involved Black youth specifically. With that said, building on the research that I've done, working with minors involved in systems of care can be really difficult on many levels. There's IRB approval, there's buy-in from participants. There's also the task of building relationships with organizations to really foreground the research and work collaboratively. And that takes a lot of time. It's a good obstacle, but it's an obstacle nonetheless. And then one more obstacle, I think, is finding funding for this kind of work as well. There are times when funders will want you to focus on all populations instead of just one specific racial group. And while the goal is to be inclusive to all, it's really important to understand that when we can support those with the greatest challenges, and I'm thinking here specifically about Black youth who are overrepresented in the juvenile justice system, we really end up helping everyone. So unfortunately, that narrative isn't always as compelling as I believe it to be. So I've found that to be an obstacle as well.
Thank you for sharing that. Yeah, I've read, I teach a class on forensic social work, and it's unbelievable. Some statistics, 4 times more African-American youth are in juvenile justice system than white youth, for example. And the sentencing project, just the harsher sentences that get meted out. So a lot of social injustice kinds of issues
Yeah,
filter
and a lot
in.
of variability too by state on sometimes county on when to transfer to adult criminal legal system. And I was speaking with my class yesterday about drug court, and 2 students at 2 different placements had 2 different experiences, and they're about a 10-minute distance from each other. And so the variability, I think, also doesn't add to this problem.
Well, tell us a little bit about your findings. What did you find?
Yeah, of course, I'd be happy to share that. So first, let me just share a little bit about the methods. I conducted a secondary analysis using 5 waves of data from a data set called Pathways to Desistance Project. And this was a multi-site study of serious juvenile offenders from adolescence to young adulthood that took place in Philadelphia County and Maricopa County here in the United States. So for this study, I looked specifically at a sample of participants who identified racially as Black, and I used a statistical analysis called a random intercept cross-lag panel model. It's a lot of words. But basically, this estimates the longitudinal and bidirectional influences of mental health symptoms on connectedness and vice versa over time. So really what that means is I wanted to understand over a period of about 5 years, does mental health impact connectedness, or does connectedness impact mental health? Like the chicken and the egg sort of story. And so how also does connectedness and mental health change from year to year? So there were two, I would say, key findings in my study. One was that among the sample that I was looking at, mental health symptoms at baseline, this was when they were about, on average, 16 years old, those mental health symptoms predicted an increase in connectedness scores. Meaning as mental health was getting worse, their connectedness scores were getting better as well, which doesn't feel like it makes intuitive sense, but it can really be tempting to attribute this credit to mental health treatment and other rehabilitative services that may have been offered, where you might say, well, if their mental health was getting worse, they were probably being referred to better services, which connected them to people. But research tells us that Black youth who are involved in the juvenile justice system experience the enduring challenge of systemic racism as they navigate meeting their mental health needs. And they're not always referred to services at the same rate, let's say, as their counterparts. So rather, one explanation that I came up with, or that I attribute to this, is that Black families, Black communities, and Black peers may be the ones doing the work of supporting Black juvenile justice involved youth during this early period of formal system involvement. Another key finding was that connectedness increased, as you mentioned earlier, overall for connectedness increased overall for 2 consecutive years, but when they were transitioning to adulthood, something happens that disrupts that annual pattern of the increase in connectedness. So I didn't investigate what specifically that disruption was in my study, but we can infer, thanks to existing research on this stage of life, that in the transition to adulthood, relationships to others begins to change. And at the very same time, in this sample, mental health worsened. So the transition to adulthood is also a time when mental health illnesses usually have their onset. And the key here is that if connectedness helped those youth when they were 16, when they first entered into this system, then social workers need to try and leverage these important relationships that help facilitate support as well in the transition to adulthood. So it works as a teenager. How do we get this to work in the transition to adulthood? And this really illuminates a point of intervention for social workers who work with transition age youth, who is a really challenging population to engage, and who face a lot of transitions, like going from systems of childcare to adult care. And that can be really complicated for anyone to begin with, right? And imagine those who are within systems like foster care, behavioral health systems, and the juvenile justice system. So those are about the key findings in the study.
Thank you. And it does make intuitive sense to me, because I think of a youth who's gotten in trouble with the juvenile justice system, and the community and the family rallying around to try to help them. And then very often as we enter adulthood, then everybody figures, okay, you're on your own.
Yeah.
And so a lot of times people get left in the lurch. So do you get a sense that the interaction with the juvenile justice system in your study, do you get a sense that it backfires as youth start to enter adulthood? It's like wearing a mark on you, that you have this prior involvement, or what do you think happens there with the
It
connectedness
can.
piece?
Yeah. So, I mean, the sort of ground explanation that I think of is that justice system involvement can be really isolating. So there are lots of inherent disruptions to connectedness that being in the juvenile justice system can create due to incarceration, probation conditions, for youth who are in high school, or whatever level of education that they're in. There are disruptions in their learning and ability to connect with teachers and peers. There's also a lot of stigma that comes with system involvement, which can lead to severed relationships and communities across several social spaces that youth spend a lot of time in, like I mentioned, schools, but also neighborhoods. And there's just a lot more to learn about how this involvement can impact connectedness. Like, this is me sort of thinking aloud about some of the ways that justice involvement can really disrupt the relationships that mean a lot to us. Yeah, I mean, just going back to my study again, with connectedness increasing after the first year um, of the youth being adjudicated guilty, I make sense of this, and I paint this picture in my head where Black communities just kind of hover over this young person in this really protective way during this high stress time. And so, maybe that's how we see connectedness increase. So even though connectedness may disrupt someone, or I'm sorry, juvenile justice involvement may disrupt the connectedness, there's also this sense that when we see a Black youth in our community facing challenges related to system involvement, you have a community of people coming around them to sort of protect them from the challenges that come with it. So I think of it like a informal sort of wraparound services for this young person, but sprinkle connectedness on it.
Well, I like that you brought up the word stigma, because I think, in so many ways, we've talked a little bit about bias and how systemic racism and bias may have a really adverse effect on populations of color, particularly Black youth. Um, Also, just bias itself and the ongoing exposure to that and the stigma. Do you get any sense of the mental health impacts of that in terms of self-esteem, depression, sense of belonging and connectedness? What's your sense of that?
Well, I mean, one thing as it relates to stigma, I think a lot about internalized stigma. There are a lot of messages that youth generally receive through mediums like social media. But there are also messages that Black youth in particular receive based on what they're seeing both in social media and as well as the news. And really just the harm and violence that happens to Black bodies here in the United States, which feels like a very regular thing. And so when youth internalize this message that they are sort of primed to be in the juvenile justice system, or this is the trajectory that folks have in mind for them, and so here I am going to fulfill it. I can definitely see how that impacts their mental health. On the other side of it, there's maybe not internalized stigma. You know that you're stigmatized as a population, but you're working hard to sort of beat the odds and not become a statistic, right? Is one way that some people think about it, and that in itself can be really burdensome and create conditions of worry and anxiety. And if something happens, what will that mean for me? And so it's definitely related to most people's mental health, I'm sure, but particularly those who are discriminated against the most in our society, and youth who are still making sense about who they are, especially with the messages that they receive from the greater society.
Well, bringing that sense of being targeted or inevitably destined to this horrible situation, and the fear that it must induce. What are some things that at the outcome of your study, what were some of the things that you thought might help this problem? I mean, as you mentioned, it's a systemic problem, and it goes way beyond the justice system and into the fabric of society. What are some of the thoughts that you had that might help?
Yeah, I mean, I think a lot from the research perspective, but also from the practice perspective, right? So let me first say that centering Black youth involved in the juvenile justice system in this study really provides an opportunity to prioritize a vulnerable population in research, policy, and practice. Right, the effects of systemic racism have been a driver of this disproportionate minority contact. And there's just so much work required in this area to minimize bias and assumptions among those who work in law enforcement, those with legal power, like judges, right? And those of us who offer mental health treatment as well. So there's a lot to be done to support this this population downstream, which is a bit more where I focus my study. So, right, in light of the findings, we do know that there's this greater sort of power that makes all of this worse, right? But in terms of change for practice, I think my study supports the importance of interventions that address the rising mental health needs during the transition to adulthood. Prior studies have pointed to the importance of like non-kin mentoring relationships in improving psychological and behavioral outcomes. So this makes me wonder how mentors and other key members of the youth social network, like family, community, peers, can be leveraged to promote mental health during transitions to adulthood. So I guess, one question comes up is, how are we bringing important people in a young person's life as part of our treatment planning? It may not be enough. I apologize, my dishwasher just is beeping. But it may not be enough, right? To just say, this is your care plan. You're going to meet with this therapist. You're going to meet with this psychiatrist. You're going to meet with this skills trainer, right? There are important people in this sort of treatment team. And how do we really usher in the important day-to-day people who have influence, who have impact on these youth's life? And so it's a little bit of a change in how we think about treatment, including important people, because those are the folks who are really going to stand behind this person from day to day after our 1 hour session is over, right? So yeah, that's some of the, I guess, ways I think about change.
Well, it really beats the drumbeat of social work, how to form communities and make connections. For people who look like me, we have to train on how to be an anti-racist and how to love people and develop our equanimity and diversity and love of diversity. For communities at large, it's how do we reach out to all of our members and how do we support them? Melissa,
And I think
go ahead.
I just wanted to add one thing to what you're saying, at least as it relates to equanimity, right? As we think about youth's presentation of their mental health symptoms, right? That sort of usually indicates how we want to go about our treatment. But we see that Black youth are often or frequently diagnosed with disruptive behavioral disorders, right? Instead of mood disorders. And perhaps, racial bias can be interpreting disruptive behaviors as, oppositional defiant, rather than seeing it masked as some form of symptom of depression, right? And so we make assumptions about how we see folks presenting that may vary in its manifestation by culture. And so having this openness to realizing that there is a very specific way that we've looked at mental health symptoms and problems, and that can vary by culture, is really important. And that doesn't sort of minimize our area of expertise. I know a lot of clinicians, I've gone by the book. I know how to diagnose this, but it's important to stay open to these counter narratives. And that's why I really like this study, because this counter narrative that we have a community of people coming around Black youth when we think that Black families are broken, and we think that Black families are broken, Black communities are broken, where they are very much a source of strength in many ways, despite the brokenness that gets portrayed in the media and through our systems. So I just wanted to follow up with that.
Thanks. I was watching a news story last night about a Black church getting things together for the tornado victims, and just the amount of community buy-in and the resources being brought to bear. So my sense is a lot of that strength has come through years of having to form tight community bonds and adaptability. And just to tag on what you said, in the forensics class, I teach a whole assignment is looking at standardized tests and assessment tools and trying to find where the bias is. Because so often, even the tools themselves that are used for assessment can contain bias that people just don't even think about. And so, yeah, there's a lot of work to be done. I so appreciate you taking the time to talk to us, and I really hope all your work, future work, goes well. Thank you so much.
Thank you for having me.
My pleasure.